My fellow Nigerians, I sympathize with you on the protracted nature of the COVID-19 pandemic and the hardships you're facing. Before I continue, let me commiserate with our president over the demise of his chief of staff. And let me use that to say that while we appreciate the apology from the PTF, we are concerned about their capacity to handle the work they're supposed to be doing, because those videos were an embarrassment to Nigeria and reflected the incapacity of Nigeria to handle this pandemic. If you say crowd was the problem, then you should not have allowed anybody to come near the venue of the burial, and no formal burial would have been required. With all due respect to the family, everybody knows the circumstances we're under, and I do not think that excuse is acceptable. Then the extension of the lockdown, I want to say, was necessary and appropriate. And once again, I sympathize with Nigerians because this has caused untold hardship to the teeming populace of this nation, and which is why we, and I in particular, are in support of the leadership of the National Assembly, the Senate President, and the Speaker and the principal officers. The statement made by the Minister of Health today at today's PTF press briefing was completely unguarded and rather irresponsible, where he said that people who contracted COVID-19 should not look at it as a death sentence, that after all, 9 out of 10 people survive. Now that in itself confirms why the PTF and this government is taking the issue of testing so lightly. Mr. Health Minister, sir, who told you can determine who will survive? Have you not seen babies dying of COVID-19? Have you not seen teenagers dying? It is not restricted to a particular demographic. And have you not heard about asymptomatic patients? Your protocol and your conditions for testing in Nigeria are completely at variance with current global best practices in testing for the pandemic, where asymptomatic patients who do not show any symptoms about the disease are being tested, because that is the only manner and the way in which you can get ahead of this disease. While all over the world, they have gone on to antibody testing, which is what we should be considering. Our health minister is still talking about 9 out of 10 people surviving. We're still talking about inability to do the diagnostic testing. I think the health minister should apologize. For this rather shocking statement of his. Otherwise, it will be taken that he has given Nigerians the express permission to be reckless and to treat this very, very contagious pandemic with levity. And the lives of those who are lost will be on your head, Mr. Health Minister, if you do not walk back the statements you have made. We appreciate your trying to say that people can survive this disease, but that does not give you any basis to make such a categorical statement as if you know the totality of what this disease entails.